wellness warriors. I'm Kayla, your massage therapy and wellness guide with over 2 decades of hands on experience. As a board certified educator and wellness business expert, I've worked with Olympians to touring with musicians, and I'm here to share everything I know about healing and body mechanics. Whether you're a practitioner or just passionate about wellness, you're in the right place. Okay, let's dive into today's session. So I saw you a couple of years ago. We talked a little bit about at that time forward head posture, things like that. And today you've come in specific diagnosis of thoracic outlet syndrome.
Yeah, it's kind of a complicated thing, but if I could like sum it up, I have like a history more of like repetitive stress stuff. I just
Yeah.
get pain in my wrists because I'm a programmer and I
Yeah.
like have a lot of sitting like all day long, and I also have like a high stress personality, so I'm like probably breathing in the wrong way. But I've been to get like a special thoracic outlet MRI, and they did confirm that I have like a lot of they call it like stenosis, but like the tightening in the brachial plexus area.
Right.
Yeah, and so I just have found, at least for me subjectively, that like when I am getting consistent work done on the scalenes, that it does alleviate my issue to some degree.
Absolutely.
I don't know if it's like 100% contribution or whatever, but I know it like it helps. So
Yeah.
I haven't like looked into it further than that.
Cool. Yeah. Okay, great. So even as I notice, you do have a reduction in mobility through your neck. Can I just see you like put your ear to your shoulder and then other side? And when you feel that, do you feel any tension on the same side or opposite side?
Yeah, I mean, I think I feel a little more on my right side, and that's the area. Like my right side is definitely
Is the
more
more
pronounced.
active area.
Yeah.
Okay, great. So obviously we're going to be working mostly face up today. I will be putting you face down. I actually feel like you get a different length in the muscles and the ability to work on the scalenes in particular in a prone position. So I'm going to leave you now. We'll get you undressed under the sheets, and I'll be in a moment.
Thanks.
So a lot of times in this whole section, I think we've actually probably talked about this before, really flows down all the way down to your groin, an area called your pubic symphysis. So I'm going to start in your xiphoid process, which is right here, and just start to release your diaphragm.
Okay.
And what is going to be a lot of fun to do is once we start to get some of this release down, you'll start to see the change in your neck before we move on directly to your scalenes. So I'm just trying to get your scalenes into a more neutral space, right? So what I'm doing is a gentle pin and pull from the subclavicular fossa through those sternoclavicular joints here. So you can kind of feel how it gets a little bit tighter through here. So I'm not using any cream right now, just to be able to give what's called shear force stretch to your superficial fascia, which exists right underneath your skin and before your musculature and your vasculature. Can you tell me if you feel more tension on your right or left side, like here or here?
Maybe the right side.
Yeah. So I feel more here on this left side and a little more here on this right side. Would you say that that's accurate for you as well?
Yeah.
So that's actually very common a lot of times when you're moving forward with this side. You'll start to counterbalance that by moving forward on your left side. And even as I kind of look down your body, I notice that you're more externally rotated on your right side than you are on your left side as well. I think we had this conversation before.
Yeah, I'm definitely not symmetrical.
No, none of us are. All right. So I'm just going to follow along with some of the tension lines here. And just draw across. Yeah, and so you really start to see kind of in the pectoralis here how much tighter it is on this right side. I'm sure you also see that.
Yeah.
So the scalenes, right? So right now I'm kind of in line with the medial scalene. It actually attaches onto your ribs underneath your clavicle. And then your platysma, which are also really tight. So you feel that right there? That's your platysma, is this band of muscle that attaches in the subclavicular fossa all the way up your neck and underneath to the base of your jaw. So just a gentle pin and pull, feeling posterior scalene here. Shortening the muscle in, which just lets the muscle know, the brain know that the muscle can relax, soften up its tissue. How does it feel over here?
On my right side?
Yeah, as I tilt your head.
That feels comfortable. It feels fine.
Because as I go like into this occiput, right, this occipital lobe here, I feel a lot of tension.
Yeah.
So I'm just kind of watching what the rest of your body does. And I do see you starting to guard on this left side as I move your head back and forth. So I'm just going to go into a position here, supporting. Do you have a question?
What movement was it that triggered you to say guarded? And the action?
So as I'm moving the head, you'll expect the rest of his body to, again, counterbalance, right? Think about it like a balance beam or seesaw around the spine, like a 360-degree balance beam around the spine. So when that's happening, when the body is in a neutral position and doesn't need to hold itself up, if you don't see a natural flow going forward, you feel like you can see it, the movement being stopped or shortened, right? That's the body. It's a guarding function or mechanism. A lot of times what it is just a patterned response to a specific position, right?
So when they
it doesn't mean that he's like feeling unsafe. It's just,
yes. If his body is responding to that movement and it's like, oh wait, not that like I don't like that, but it's just like, oh wait, we can't move that far. We don't move that way. Like, what is the communication saying?
Kind of. A lot of it is just learned patterns.
Okay.
Yeah.
So like how his body just communicates when an action is happening.
Yeah.
How it's compensated during.
Just what it's used to doing.
Okay.
Yeah.
I guess it's more of like I want to know like what is just natural to that body rather than, okay, this is something that I need to pay attention to.
You do need to pay attention to
everything. Yes.
All right. So again, here I'm just pinning the origin of the posterior scalene. And now I'm lengthening. So not just in torsion, but also a lateral pull. I'm going to support your head here. And again, I'm just kind of working on the more mobile muscles before we get into that anterior scalene, which is the mamma jamma.
That is.
It is the mamma jamma. So luckily for me, his carotids are incredibly prominent. You can also see positionally, though, his muscles on his right side, even his SCM, really pulls over. And a lot of that has to do with how he uses his right arm. So I'm just going to move up here. I'm doing this to actually shorten the scalenes because they attach into the rib cage. You have to think about them not as, neck muscles, but also how they go into the chest, or what we often consider the chest here. So I'm just anterior to the carotid. Now, you can really see how you overuse your pec muscles here. You can even see the striation onto the attachment point as I go over it. So I'm just going to ask you to actively rotate your thumb toward the floor, keeping your arm just in line. Try to press it down toward the floor. Yeah, there you go. And relax for me. Thank you. All right. So now I'm behind the SCM and into his anterior scalene. I'm supporting underneath his head. I'm watching for his facial expressions, his heart rate, if he starts to sweat. How is that there for you?
Yeah, it definitely feels tight. It's pretty tight.
So I'm just going to lengthen. So I love to get the anterior scalene in a prone position, meaning face down, because right now I'm pressing against his vertebrae, and there's a lot of nerves and different veins that I really need to think about. When he's face down, everything, gravity works with me, and I can really get into the nooks and crannies. Yeah. All right. So here we go. Right next to his trachea. Just on the edge, giving it a nice cross fiber friction. And I'm just going to do a nice trigger point here. If at any point you feel this kind of moving down your arm, it's really common, just let me know.
Sounds good.
And again, I'm just going to hold on to his occiput here. So if you feel comfortable, just give me a little shaking your head yes.
Sure.
And a little shake your head no. Thank you. So I'm going to release and then go right back in. And this just gives a nice wash of the fascial fluid. And what you'll see is it creates a whole bunch of room. It's kind of like a sponge, right? When it's not hydrated, it's dry, it's brittle. When you put some water through it, you start to squeeze it, it gets soft, absorbent.
Your analogies are the best.
All right, so I'm going to give it a little bit of a rest, let it process some of that work. And I'm going to start to go into the anterior fibers of the first trapezius. So just getting that lateral edge. Again, really working within the brachial plexus, which is medial, caudal, superficial to the clavicle, chromium process, obviously the neck. So right now I'm essentially on that like lateral edge of the levator scapula and the anterior fibers of the first trapezius. And I'm kind of working by stretching slightly with my thumbs. So it's almost like a little twisting. And I'm just kind of gently stretching apart some of those fibers, particularly when you have like an upper cross or pronated shoulder, and resulting in thoracic outlet syndrome, you'll see these kind of like glue together almost.
The fibers?
Yeah, the fascia, right? Those layers of collagen that lay down. And I'm really starting to feel them separate a little bit. Can you feel that as well?
Yeah.
So what I expect to see right now as I go over everything, I'm feeling it like almost like a big sheath, like there's plastic wrap over everything, right? And as I go in, what I'm going to expect to feel is all the striations and tiny little muscles separating out and having more independence from other structures. Oh yeah, can you feel that difference there? That's great. So this actually feels a little tighter now. Now I haven't gone to the SCM, and that's on purpose. I'm trying to make sure that I get to the scalenes as they are. The SCM is such a big muscle. Everyone wants to get in there and work on that first. And I think that's actually a mistake, particularly when someone has this overuse issue. And that means that a lot of times his head is down, he's in this flexion, he's in this, forward posture, often sitting. So, the SCM, it lengthens and shortens in rotation. The scalenes are really for more like lateral and flexion movements. So you want to think a lot about, why it is that you're going in and why it is that you're working on what you're working on. And what the flow actually is. So I'm really directly on his posterior scalene. And the reason that I start there is because I like to think of working toward the most tonic areas, the most hypertonic areas. I call it untying the knot. When you have a necklace, you don't take a kink or like a knot out of the necklace by going directly into the middle of the bird's nest that has ensued from that knot. You unweave it from the ends, and slowly, slowly, you can kind of make sense of the jumble. And I like to think of that as well with the body. If anyone's ever taken like a knot tying class or a sailing class, you'll kind of see how even some of the best knots are made by making these loops over here and then something threads its way through. And the body is the same. So I'm noticing that as I'm working through the left side, his right occipital and levator are tightening. And so I'm positioning his head so he's still there. I'm actually noticing probably one of the tightest areas is that right occipital. And so while I, do think that there's some like strength imbalances that we could work on, right now we're working on releasing. And so I'm just going to think about the relationship that these muscles are in around his spine and around his cervical spine in particular. Again, they're constantly trying to balance his spine in relation to his eyes on the horizon, right? So, people's spines and muscles will do all sorts of things to kind of keep your eyes level to the horizon. That has to do with your vestibular system, right? Like your balance, all sorts of stuff, his breathing. One of the things that Ian mentioned in his intake is that, sometimes he thinks he breathes like from his shoulders. And I'm really noticing that he's doing some really good diaphragmatic breath, but it's like half of the breath. And I think that's just because he's relaxed and his body is for sure like alert and aware to the fact that I'm just like digging in on these scalenes. So again, I'm making sure to stay just posterior to the carotid. I have my thumb kind of supported with my other fingers. So with the back of my fingers, I'm actually giving a little bit of a pull and then supporting in, letting his head kind of lead into a softening there. So I'm on his medial scalenes now. They really work synergistically. They're almost a complete synergist set of muscles, meaning that they almost always work in alignment with one another. And I have my other hand on his other side, on his back, because I'm really thinking about what his symptoms are, which is his right side. And so I'm always thinking about, how are we balancing this? Really, not like, oh, I'm going to even it out by doing the same stuff on both sides, because we are not bilateral. That's not how we work. And if you have any other questions, like feel free to ask.
Okay.
Yeah.
So far, every time I do, you end up
saying it.
Awesome. It's a
Awesome.
superpower.
All right. So again, I'm just going to go in. I'm going to check and see how are we liking this rotation here. I'm definitely noticing a lot more mobility. I haven't gotten into his anterior scalene. You can actually see it as I start to stretch. You can actually see it kind of pop out there, and it is super pronounced. So I'm just going to start in this position, and then I'm going to soften it back down into a short state. And as I do, it hides away. We go after it here. So again, I'm just behind the SCM. I can't tell you how often. And you see how different that feels? It's just wild.
Yeah, when you're on the anterior scalene, it's very tender.
Yeah.
For me.
Yeah, there's a lot of nerves through the brachial plexus. So you really have to understand when you're in here, what does a nerve feel like? And what does a muscle feel like? What does a vein feel like? It's really important. Yeah. Nerves feel like wet spaghetti.
Okay. Wow.
Muscle feels like meat that's either overdone or underdone.
Mm-hmm.
And usually with the vascular system, you can just feel it pumping.
Yes, that is like the easiest thing. The minute that I feel a pulse, I would release and try to palpate around and then refind.
And then also sometimes with smaller veins,
mm-hmm.
I call it like feeling them breathe. And I know that sounds a little esoteric, but it's not strong enough to kind of push against your thumb. It's more of like a gentle breath. It's hard to describe it otherwise.
Can I ask about how thick the anterior scalene, or just the scalenes in general, like are?
They're not very thick. So yours are actually a little bit more defined, and I think that's just from overuse. But they're really meant to stabilize your cervical spine, which is designed for movement and motility. Your lumbar is designed for stability. It still has movement. So they are small. They actually kind of finger out, right? So they like kind of originate around your jaw and then kind of spread over this part of the neck to help. They're almost never they're not ever operating independently of anything else. Not that anything in the body happens independent, to be honest.
Something I've found is like, for example, when you're working on the anterior scalene, I subjectively feel it as tender and very tight.
Yes.
I can say that on average, when I go see, maybe a less experienced therapist and they're working on my neck, like it's kind of making me think that they may not even be directly getting the anterior scalene, because I don't think I'm really used to feeling it directly there, or maybe it's just the technique you're using.
Yeah. I would say a lot of times, a lot of therapists, so in school, you're not taught to work on this part of the neck because there are so many nerves, there's so many endangerment sites, just meaning if you don't know what to look for, you can, innervate a nerve because you're pressing too hard, or obviously because of the carotid. So a lot of times what you'll find is that therapists don't know how to palpate that, particularly the anterior scalene, because it hides the attachment points, and like the first third of the anterior scalene in particular hides behind the sternocleidomastoid.
Do you have any tricks to find it, or?
Yeah. So particularly like for yourself, one of the best ways for you to find your own SCM is a way to be able to delineate it from the anterior scalene, right? So when you turn your head and then try to lift your ear like kind of up, your SCM pops out. Go ahead and take this hand and feel it right there, right? So so squeeze it with your thumb and your foot. So that's the SCM. Now, if you take this middle finger here and just push down, that's your anterior scalene. I see. You see? So that's how you can kind of identify it. One, by identifying the SCM, and then two, finding the muscle behind it. And then if you keep your finger here behind the SCM, bring your head back to neutral, and then just press down toward the table. There it is. Do you see that?
Yeah.
Yeah. Now, I will say this, Ian. A lot of times when people feel really tight, they're like, oh, this felt really good, so now I'm going to do it all the time. And what you can do is irritate that muscle, inflame it, and almost make it worse. So I will say this, less is more, right? If you would like a self-massage routine to do at home, I will give you one. How about that?
That would be perfect.
Okay, great.
Maybe we can film that too. So
I think we can film that too. And then when I put it on YouTube, then you can just watch it on there.
That would be so helpful. Awesome. To be honest, I've looked so many times for this type of self-massage routine for scalenes, and there's no good material on YouTube for that. It's very hard to find.
Who wants you to go to YouTube instead of come in, but they don't even know what they're doing at the time.
Right.
People who don't live here.
I totally want people to go on YouTube because I feel like, okay, try to relax your head deep into my hand. And so I'm holding my arm behind his head to actually get his neck into a little bit of extension here, right? So we've gone through, I haven't used any cream on you yet, and now we move into that. There are a ton of nerves that run around here. The vagal and fascial nerve run deep into the ear. One of the easiest ways to actually release the neck, and because the scalenes attach right here. This is a really nice fascial pull. So I'm just taking my thumb kind of to the back of his ear. I bring my fingers over here and I'm pulling. Now I like to do this with a little bit of cream because this is a really delicate structure and it just feels better when you're not pulling on the skin. And then integrate down. So again, I'm going to move through the entire sternum to the diaphragm. This is a system that works together, particularly, Ian's sitting, his head is forward, he's working on all this stuff. And let's not forget, even though, our focus is his scalenes, I'm going to work from his fingers up his arm because that's how your body works, right? When you're tight through this whole system, you have to release the whole system. You can think about it like, if a sweater isn't sitting right through the shoulder, you keep adjusting the where like the shoulder of the sweater is knit together, but it keeps getting pulled down or away because there's a knot in the sleeve. You've tied the sleeve up and you're like, I don't know why it's not fitting right. Well, it's never going to fit right until you release the knot down further in the sweater sleeve. The superficial fascial structure, you can think of like a second skin. And it truly is the analogy of like a fiber, like a knit fiber that weaves back on itself and is three-dimensional, is the most accurate thing, really. It's not complete, but it's quite accurate. Okay, so now I'm going to go across and over. And what I'm doing is I'm just feeling from the back of his second rib, third rib, and I'm going to feel that same rib on the front as well. Just want to see if it's out, what's happening, how does it move, right? For sure, his third rib here on his right side isn't moving nearly as well. We often like to think about the body as front and back, but really you could think of this as side to side if you wanted to, and this side body could be the front. You can't really think about it that way because so many muscles wrap in and around and through. So his anterior deltoid here is really, really tight. So this is a great example of if I don't release this anterior deltoid, it's going to pull down and onto his acromion process, pull this entire structure forward, and then his scalenes will just go right back, working the way that they are used to. So I'm going to shorten in and then go toward the area.
Yeah, that's
Yes.
And again, you have all these nerves, right? So brachial nerve, medial nerve runs through here as well.
Yeah. I've had a lot of work on my median. I mean, I had carpal tunnel surgery.
Yeah. Right.
This year.
And you can actually see that.
Is the incision site on your wrist, if I may ask?
Yeah, my palm.
Okay.
So carpal tunnel
there's
is just a fascial structure which a bunch of nerves and muscles run through.
Yes.
When that fascia, just like anything else, gets tight and overused and dehydrated, they recommend literally cutting the tissue just a little bit to release the tension.
I watched just.
And you're working on the adult, I can feel some referred sensation on the median.
I bet.
But
Yeah, I'm not surprised.
It's not like shocks, but just mild. Yeah.
Sure, yeah, because, again, right, nerves, they are really mobile. They're noodly, truly, like if you were to take it out, but it has no stretch. So anything that you do, any movement that you make to a nerve, to anything that goes through or where a nerve runs through, that goes over or sheathes a nerve, oftentimes when it's tight, it will refer somewhere else because there's nowhere for it to move, right? So usually like the sheath and the fascia will start to stretch and move to allow that nerve to glide along its track. If those structures that are meant to do that don't do that, you'll get referred sensation. So that doesn't even mean you need to be on the nerve. It just means that you need to be pulling, tugging on those structures that are tense that refer to that nerve.
Yeah, it's really interesting to me that you're kind of going to the shoulder as well, because I know like drooping shoulders is a very big predictor for like the thoracic outlet.
Yeah, because literally what you're doing is asking your neck muscles to support your shoulder. And those muscles are tiny babies, and they're meant for mobility, not for stability. I mean, obviously, everything is like on a grade, right? So everything has to have flexibility and stability. Even bridges, right? You have to account for forces for wind. And if you don't bend a little bit, you break. Even really tall buildings have to account for that. So do our bodies. So everything is in a grade, right? So if I'm saying something is meant for flexibility, mobility, not stability, that means like it's 70% mobility and 30% stability kind of thing. Not all or nothing. So again, I'm just shortening this down. That's really to protect the nerve.
Giving it some slack.
Giving it a little slack, yeah, so we don't strain it at all. So I'm just going to ask you to bend your elbow, keeping your arm on the table till you touch my arm and press into my arm slightly. And then release it back out. I'm going to release the tension here. Let's try this again. Again. Oh, press a little bit more. There you go. And relax. And we'll do this one more time. And press up into my hand. You can see that whole line really activate here. And relax. Just a little positional release yet. And press up. Yeah, there we go, right there. So I'm deep into like where the anterior delt, pectoralis minor kind of meet and relax for me. Beautiful. Yeah. So that really helped to break up a lot of that. Now, even if you want to. All right. So really all I'm going to do is run through the brachioradialis. That's really where that medial nerve runs through, and then do a little bit of scar tissue removal through there. One of the interesting things about scar tissue is that regular, healthy, like non-scar tissue is organized. Scar tissue is disorganized. And disorganized tissue can proliferate disorganized tissue, which means if you don't release and almost really think about it like organizing that fascia, it can the only word I can really use is burrow deeper and kind of create this boat-like structure of disorganized tissue around the initial scar. And so there's a lot of things that you can do to help release some of that. And you can really see it goes into his palm. There's the scar. And so going along the edge, right, giving some slack on this side.
That's interesting to know because, like, I did scar tissue massage as a part of my recovery.
Yeah.
But I have been noticing, it's been over a year since I had my surgery, but I have been noticing that I still have significant tenderness, like when I do push-ups and stuff like that. Like, the area is still quite sensitive.
Sure. And, you know, if you're not doing that regularly, you can absolutely proliferate some of that scar tissue. So because I do feel all the symptoms, if you will, of scar tissue around this cut, and I will say the body knows what to do with like really jagged, variegated scars and cuts and tears much more than it knows what to do with a straight cut like this. They do this cut just to minimize the impact, but at the same time, there are no like really straight lines like this in the body, right? So this is almost like a dam, a barrier. And so the body's kind of like, what do I do here? So you'll see I keep going over it. I'm doing C's around it. And I'm also, with my hands, I'm actually bringing the tissue in. So I'm not straining. You also notice I'm not pulling apart because again, this junction here where the tissue meets will be less stable or integrated.
Scar tissue is usually not very, well, because it's disorganized and not uniform how it once was, it's thinner. So maybe that's why you'd want to remove.
It's thicker. Yeah, scar tissue is thicker. Just like if you break a bone, it grows back more dense. Anytime you injure yourself, one of your body's really effective defenses is to grow something back in a more dense fashion. So it's harder for that to happen again in that area. It is not thinner. Okay, so now I'm just going to start to integrate the work that I'm doing here. And, you know, there's a lot more that I could actually do with the hand itself. I could probably just spend an hour on his hand and forearm, honestly. Ian's like, yes, please. So moving up the brachioradialis here. So one of the things that I think a lot of massage therapists get wrong when they do massage is that they stop at a joint. No muscle stops at a joint. The reason joints bend is because it's a cantilever system. So the muscle always crosses that joint onto another structure so that when it contracts, it moves the joint back and forth. So when you're massaging, please finish the muscle at its origin or attachment, which will cross a joint. Almost always, it never stops at or before the joint. Please, please, please. If you're not sure of where it attaches, just cross the joint anyway. So this is the system in its entirety. When thinking about his brachial plexus. So I am going to go back into these scalenes. I've given them a rest, they've integrated some work, and now I'm going to turn him over and work on him prone so that I can actually work with gravity. So the first thing that I'm sure everyone who's looking at this can see is how different these two shoulders look. And this is a vantage point that you wouldn't get if you don't turn the client prone to work through the, anterior structures. If you think about this in relation to the tension that he feels on that right side, and you think about this as a 360-degree, tug of war, if you will, this is pulling back, this left side is pulling to counterbalance what's happening here. So while I am going to work this side, I'm also going to focus on the muscles on the left-hand side, again, to create more neutrality around the spine. And that's how you think about the system as an integrated part of a whole, right? So if we were to ask Ian, like, hey, Ian, which side bothers you more? He might actually say the right side. But again, I have this analogy of the victim and the perpetrator, right? The bully is often not the one that we feel in our day-to-day. It's the muscle that's more weak. It's the weak link in the chain is the one that we notice the most. But not why is that link weak. I think oftentimes doctors do this too, is they'll say what, and then once they give you the Latin name for the issue that you're experiencing, then all of a sudden you have a diagnosis, and for some reason that's enough, but you're not asking why. Why is this happening, right? Well, sloping shoulders. Okay, so what does that mean? And so thinking about this, releasing some of this posterior tissue will help this feel more neutral over time. So all I'm doing is working through the serratus anterior posterior, which is here, the rhomboids, the levators, splenius capitis for sure, and then the posterior fibers of the first trapezius. Depending on, what I'm focusing on for each session, I would probably also go into the posterior muscles here for the rotator, and for sure his lats as well. One of the things that as I look around and I start to notice is that his lats are really weak. And now that's not surprising to me. I would say the number one thing that would help Ian outside of this massage would be to strengthen his core and his lats. The more stable his really large, broad muscles are, the stronger they are, the more his smaller muscles can work the way they're meant to, which is with more, say it with me, mobility and flexibility. Right.
2 questions.
Yeah.
So for the lats, you're feeling
Give me 1 second. So I'm just feeling along here. You have all these paraspinals, transversus spinalis, these really tiny little muscles that help to stabilize each individual vertebrae and to flex, arch, your spine. And so I'm just going to go and do a little bit of cross fiber friction. Oftentimes these are I like to think of them like the front line in that tug of war. So since I'm working through here, these are responding actually really nicely. I'm very happy with that. As I'm doing that, I'm noticing that they're just kind of pinning down to these spinal muscles. With that, one of the things that I see therapists do with these small, paraspinal muscles is that they pull away from the spine. But what do we know about the spine is that all of these nerves radiate out in between each vertebrae. And so what you're doing is you're actually pulling at the nerve really kind of at its root. So what I would say is that you can go up and down and toward. So even if I'm pulling back, you'll notice that I'm stabilizing as well. Thank you.
Yes. Of
Question
course.
about the lat.
Is it your palpation is how you feel, like your feeling is how you determined that it is weaker, not
No, I'm just literally
look-
looking at his
Okay.
lats. I mean, I know enough where I can see some pretty common symptoms of weak lats.
Okay.
Sloping shoulders, just the structures here.
So
But
everything
you can
is
look at them. So the lats are like these big wings.
Mhm.
And so you'll see like a nice, chunky, meaty section here that just isn't developed.
Okay.
And anyone that doesn't train their lats specifically with pull-ups and, lat pull downs and stuff like that, you're not getting to those muscles,
Mhm. Okay. And it's like also because you had him supine and you saw how overactive other muscles were, is that also like your key point? Because you see how everything else is?
I wasn't thinking about his lats until I really came
Yes.
over here
Right.
and started really looking at him, which is why it's important, no matter what muscle you're focusing on, is to think about the body as a whole integrated unit, right? Around the spine and the hips. Everything just contrives toward keeping those in a perceived alignment.
I like that because it's definitely perceived as different to everybody. Okay. Oh, yes. And you answered it already because when you were doing the
All right. So here I am coming to the medial superior edge of the scapula. One of the areas that I think a lot of massage therapists miss is the spinous process. It is superior. Well, anyway, I can't remember the name of the
that's
muscle.
so fine. That's super.
I'll put it, yeah. It's the muscle that sits superior to the spinous process of the scapula. A lot of times people want to go right into the trap, and so they press down onto the trap itself, right? But if you actually get onto this muscle here, you're going to have a much greater release of the posterior fibers of the trap, particularly in like a pronated shoulder forward head posture. Ooh, I just hate it when I blank on stuff.
Is it bad that I'm kind of upset? Because I'm like,
You're like,
well,
I want to know what it is.
yeah, like,
It's all
tell
right.
me what you're touching.
I'll put it on the thing.
That's not supra?
What?
Spinatus?
Supraspinatus. Oh my God, thank you.
Okay. I was like, am I wrong?
Thank you. Yes.
Because listen, I've been a couple
Thank
times.
you. High five.
Yay.
All right.
Anatomy. Because I saw the infras popping out, and I was like, Amy, do you know that?
All right. So now, instead of pushing down, I'm pulling up. So I'm in the anterior fibers and posterior fibers of this big juicy trap. Look at this bad boy. Mamma jamma. All right. Mamma jamma. And I'm just going to walk. I don't love pulling on this because it attaches all along the spine. And again, it's already pulling so much. As I get a little bit closer, once I kind of get to that medial edge of the scapula, I'm going to start going into the medial scalene and start playing with their relationship. I'm here just pinning down the levator scapula on his left side, medial scalene on his right. Again, they work in opposition. Are you looking at that muscle?
I have, yes. No, I don't, because this is not my. I have a 3D model of the human body, and you can like piece it together, take it apart, put it back.
Nice.
Yeah.
What's it called?
It's called Atlas. It's like $25 in the App Store. So worth it. But you get to.
We'll put a link of that app in the.
Absolutely, y'all will love it. It was a gift to me, and it helped me pass.
Awesome. Okay. Here we go. So now I'm just curling my fingers under and pushing up. It allows me to really move stuff out of the way in a really different way to him being supine. You see the difference there, Ian?
It doesn't feel as tight there, like compared to when I was in front. Maybe it's
We
the work you put in already, yeah.
All right, now I love doing this with the anterior scalene because it really lets me get the SEM totally out of the way. And I'm just going to stabilize again on this posterior side of his neck, because as I do this, it's going to rotate his cervical spine. And try to push it over from side to side. So sometimes when you get really good work like this, you're like feeling awesome. Other times it might feel a little headachy, you know? His muscles get really tight, we release them, there's all these nerves. They attach his head to his body, you know. He's gonna feel it. So here I'm actually up in the hyoid bones, the omohyoid in particular is really tight on Ian here. Right up in here. You feel that there?
Mm-hmm.
Mm-hmm.
Yeah, that is more tight.
Mm-hmm. Yep. Swallow for me. So the hyoid bone on men is really easy because it's the Adam's apple. Women have it too. It just doesn't develop the same way because we have less testosterone in our bodies.
I have a conspiracy theory for you about that.
Tell me later.
Yes.
Sure, everyone watching this is like, I want to know what it is.
Sorry, guys.
All right. So again, less is more. There's a lot more work I want to do here, but I also want to leave Ian's neck like kind of knowing what to do in life. So I'm going to come over to the other side and just get into here a little bit. So again, you see that I'm stabilizing on this left side. I'm going to stabilize the scapula, and this is really just because of the way Ian uses his body. I'm stabilizing some of his ribs as I push up. So on this side, I was pushing in this way, and here I'm pushing this way. And that's just the way he's developed his muscles from overuse. So again, I'm not doing symmetrical work. He's not symmetrical bilaterally. I am getting onto this right side because he, does have this kind of upper cross. It's important that we address both sides, but you'll notice I do things differently. So here, definitely his rhomboids are more prominent versus his left. And again, if you think about this sloping shoulder, drooping shoulder, you can think about how that's going to affect how he uses this shoulder to retract and protract his scapula. Always going in toward the spine. Ooh, I bet that feels good.
Yeah, very tight.
It's so tight.
Mm-hmm.
Yeah, so these transversus spinalis are just like, sup. Okay. You can see how, as I move through his body, you notice this sheath of superficial fascia kind of moving along with me. If this were a healthier system, you would see more independence. You wouldn't, his skin would be moving, but not some of the structures underneath. It would look more like a glide. I like to call it a wave. The very last thing I'll do, will be out of camera, is that I'm just going down onto his sacrum and just giving it a little bit of a stretch. Again, just feeling on either side of his spine. Noticing, I like to call it bookmarking. So just kind of bookmarking some of the muscles that I am curious about a little bit further down, like his second and third traps. Again, some of the attachments points of his QL, his TVA, right? Which kind of right there. Just feeling through and I'm watching. So how does the sacrum react? And then what happens as I pass over this a few times? How responsive are the muscles, the tissues? Yeah, so splenius capitis over here just needs a little extra love. And then I call it a little mushy at the end, a little sweetness, letting the body know it's ending the session. You don't want it to be so abrupt. Another benefit of doing this is that it actually helps to move some of that fascial fluid that, as you massage any area, will create some local inflammation, which is a good healing thing. And then it helps to kind of flush and move some of that fluid. As I'm doing this, I'm looking to see if there's anything that stands out that I can put in my soap notes at the end. All right. Ian, thank you so much.
Thank you. Yeah.
Ian, how are you feeling?
It definitely feels better. I tried to poke around in that spot you shared, and it was like, oh, it's a lot looser than before. Yeah.
And actually, I think if you were even to like look up and kind of feel how that feels even through your whole body, right?
Yeah.
So obviously, as we were going through the session, I talked to you a little bit about some strengthening exercises.
Yeah.
This is, always a conversation that massage is really important. It's not a one-trick pony. We're dealing with some of the symptoms that are like a little bit of a greater thing,
Totally.
right?
Yeah.
Whenever you're ready for that, you can just never do it and, come in and that's fine.
Yeah.
But if you ever did want some exercises, that's something that I'd be really happy to talk to you about.
Yeah.
Outside of that, though, I'd like to have you be able to go home with some exercises and some self-massage techniques. Placing it down this way, or pulling it behind your back and then pressing it hard into your back and letting your eyes gaze up towards the ceiling. This is a way to get much deeper into essentially the posterior scalene mostly. Okay. One of the things I'd really like you to work on is making sure that your fingers are on either side of your ear. Let's try the other side. So here, stretch. Now you can stretch your fingers, flex your wrist, and then pushing your wrist down towards the floor or on the floor if you're sitting. Then you can twist your hand behind your back like this. You're going to press hard with your whole forearm into your back, and that helps to really stabilize the shoulder and stretch down. If you'd like a deeper stretch, you can look up to the ceiling and then kind of shake your head yes and no. You'll get to a couple of different fibers in there, really pulling down your ear to your shoulder. Okay. Love these massage and wellness tips? Join our Healing community by subscribing and massaging that notification bell. Drop a like if this helped you and share your questions below. See you in our next session, Wellness Warriors.